This is a podcast from News Talk Radio 710 WOR.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving to special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. Good morning, Rob, my co-host. How are you today?
I'm doing very well. How are you?
You look fantastic.
Thank
we
you.
have Mike and Eddie in the control. And Mike's running the program for the first time, so we say, do the great job you always do. We love you. There's a lot of news this week about cancer. There's always cancer news, and people that have cancer or loved ones with cancer really want to hear the news because sometimes it's hard to hear the details in other places or hear it at all.
Definitely.
You've been interested in robotic surgery recently, and there was an article in the New York Times this week about robotic surgery.
Oh, yeah?
You know what robotic surgery is?
So it's a type of laparoscopic surgery, basically.
Yeah, but it's more than that because, or it's an extension of that. I mean, laparoscopic surgery was making little holes in your belly,
right,
and sticking cameras in, and then the surgeon, with his own hands, manipulates those cameras and the instruments with his own hands.
Right.
From outside the body.
Yeah.
So robotic is one step beyond that with his device. So you can move your hands in Cincinnati, and the person theoretically could have their surgery in Timbuktu because the surgeon is supposed to see things, move his hands, he has a light there, and they're supposed to be able to see better, see the nerves and see the blood vessels, so there's less complications.
Right.
And they call it Da Vinci. Now, Da Vinci was an Italian artiste, right?
That's right.
And he probably didn't have anything to do with this gizmo.
Probably not.
Because I think he died like 400 years ago, something like that. So they call it Da Vinci to appeal to something fantastic like a piece of art.
Sure.
But it's a gizmo, and right now, this gizmo is the number one procedure for prostate cancer in America.
Oh, wow.
So overnight, it's overtaken surgery and radiation to be the number one most popular, I didn't say best,
right,
the most popular procedure.
I noticed you were very careful not to say best.
Yeah, because the article that came out this week, and it was published... it was a synopsis in the New York Times, but it was in the Journal for Healthcare Quality, looked at complications of Da Vinci surgery. Mm-hmm. Now, when there's a complication, the doctors in the hospital are supposed to report that complication. And they talk about this woman, Erin Izumi, who's in the 30s from Tacoma, Washington, and she had endometriosis, who's going to have a robotic simple surgery to remove the endometriosis in her body for whatever reason. And 10 days later, she went to the emergency room, and she had tears in the rectum and the colon.
Oh, no.
So, I mean, you see what happens to people that have a perforated colon and a perforated rectum. They're sick as heck.
Yeah.
And often die, even 30 years old.
Right.
So she was in the hospital for 5 weeks. She nearly died. She had multiple surgeries to try to repair the holes in her rectum and in her colon. And then, of course, she went to a lawyer, and they settled this case last year. And you think with a case like that, the hospital and doctors would have reported a complication to the company, right?
Yeah, you would think.
I mean, they're required to legally.
Yeah.
And it was never reported.
Oh, no.
So the Da Vinci system, the Da Vinci people never reported it, even though it's been on the market for a decade. There's been 1 million procedures. They've sold many machines for almost $2 million on average. So you can multiply all those machines times 2 million, and it's a lot of money. They did, however, report that there were 174 injuries and 71 deaths related to Da Vinci surgery. But as I say, the researchers at Johns Hopkins who then went through the data found that the complications and adverse events, as they call them, were vastly underreported.
Sure.
Like this woman who nearly died. It wasn't reported.
Right.
Well, what happens when it's not reported?
No one knows about it.
Yeah, so if you're a doctor, let's say you're a doctor and you're trying to tell your patient the risks, benefits, and alternatives of a procedure,
right,
and you don't even know them,
yeah,
how can you honestly advise patients as to the risks, benefits, and alternatives? I mean, you can't, and that's the problem, that when the reported complications are called, and the article calls it, quote, the tip of the iceberg, it means that the patient doesn't really know the real disadvantages of the procedure. And if they don't know the real disadvantages, then they can't really make an informed decision.
Sure.
And that's kind of the problem. The urologist does the biopsy on the man. The man usually comes, he has an elevated PSA. He wants to know is it cancer or not. He gets a biopsy, which is putting a needle into the prostate, which is usually pretty simple and should be painless.
Mm-hmm.
And then the patient should come back and see that doctor and other doctors. They should get second opinions because there are competing modalities.
Right.
And the doctor, it's incumbent on the doctor to tell the patient all the risk, benefits, alternatives. Well, if the doctor doesn't know the risks, then he probably downplays the risks.
Definitely.
And probably tells the patient, well, there's this new machine, and it's $2 million, and it lets us see everything, the nerves and the blood vessels, and so the surgery should be more perfect.
Sure.
And so you can understand why men are led to that path.
Yeah, definitely.
And sometimes you wonder if it's like sheep. Is it sheep or lamb to the slaughter? Which one? Which goes to the slaughter?
I don't know. Maybe sheep.
Sheep. But in the Silence of the Lambs, I think it was lambs. So the professor of surgery at Johns Hopkins said that this expansion of surgery has taken place without proper evaluation and monitoring of the benefits. Now, they've sold 1,400 Da Vinci systems. They cost about $2 million, so that's, what, $3 billion.
Mm-hmm.
So you can imagine the hospitals are pushing people to use the machines because they have a $3 million machine in the corner.
Right.
So they have to use it and get reimbursed for it. And then there was a study in 2010 that said that 56% of surgeons surveyed anonymously,
of course, yeah,
had reported irrecoverable operative malfunctions while using the Da Vinci system.
Wow. That's not a good number.
Yeah, so it's really worrisome that, it takes a paper like this 10 years after the system comes out to talk about the potential complications. And the idea really to talk about it in the program is that it's the number one procedure as far as popularity, and we talked about why it may be popular, and yet we don't really know the real complication rate.
Sure.
By the way, we're live. Believe it or not, we're live. We're not like the other programs. We're live. We're sitting here at WOR Studio in the middle of Manhattan, next to Zuccotti Park on Wall Street, not far from our office, our office is at 38th and Broadway. And you can call us if you have a question, 800-321-0710. 800-321-0710. And then there's another paper that came from Harvard, which is my alma mater, and they looked at men who had open surgery, so it means they had to cut, and the surgeon put his hands in like they usually did and try to find the prostate. Remember, the prostate sits between, do you know where the prostate sits?
Between the rectum, right, and the bladder?
Right. So it's like right in the middle. If you imagine you've got a sandwich, a prostate sandwich, on one side the bread is bladder, and the other side is rectum, and on the sides it's nerves. So it's very delicate to remove the prostate and not hurt the nerves, which are important for sexual function and urinary function. That's the issue. So the study looked at men who went through surgery, either open surgery or robotic surgery. And there were 220 men who had open surgery, and about the same number with robotic surgery. And the continency rate, meaning if you're continent, it means you control your urine. If you're incontinent, it means your urine's leaking.
Right.
So what percent of men had no problems with continence? Well, if they had open surgery, 19% had no problems. It's already telling you it's a problem because with open surgery, you got 80% of men having problems.
Yeah, the majority.
the vast majority. And if you had robotic, which is supposed to take care of all these problems because you can see the nerves, blood vessels with your big cameras and lights and mechanical hands.
Right.
The problem with Kansi was 87%.
Wow, so that's even worse.
It's even worse. So only 13% of men of 406 who had robotic surgery said they had no problem controlling their urine.
Sure.
So 87% of men had problem controlling the urine with robotic, and with surgery, 81%, open surgery. And sexual function, which is really the $64,000 question, because that's what many men want. They want to be cured. They want to avoid surgery. They want to keep their sex life and their urinary life. That's normal. They want to be a normal man.
Absolutely.
So if you had open surgery, sexual function was normal in 2.9%.
Okay. So
Meaning it was abnormal in 97%.
Right.
And if you had the super-duper robotic surgery, sexual function was normal in 2.3%. So it means 98% of men who had robotic surgery are having problems with sex life, and more than 80% problems with urinary control. And remember, it's still a big operation. It's opening up your body, trying to dissect out the prostate and to avoid harm to the bladder and the rectum. And then you look at success rate, and if you compare, like our technology is totally non-invasive. So there's no cutting, no bleeding, no operations. If you have a PSA, prostatic specific antigen blood test, and it's 4 to 10, and you go to one of the most famous surgeons in New York, his 5-year chance of making you cancer-free is 76%.
Okay.
So you had all those complications.
Right.
And only 3/4 of the men are cancer-free. With us, it's 90%.
Okay.
If men come to us
Big difference.
for brachytherapy and body radiosurgery, it's 90%, 18% better.
Yeah.
And there's 200,000 men a year with prostate cancer. So 18% difference is 36,000 men saved.
Yeah.
So it's huge numbers.
Yeah.
We're talking about doing surgery on 200,000 men. It's making 195,000 having sexual problems and probably 180,000 having urinary problems.
Yeah. It's higher success rates and fewer complications.
Yeah, so I really tell people to investigate the options when you're diagnosed. Don't jump in and have a treatment, because once you have a treatment, you can't go back. You can't do the untreatment. So it's really important, and sometimes we just telling people the most important thing is get a second opinion now. Come on in, look at our booklet. We have a booklet called Prostate Cancer. It's free. You call in, we send it to you, we do a DVD with it, and you can read it yourself. You can see the data. We're proud of our data. We've treated 3,000 men. And you should read the data first before you make a decision. That's all I urge, to be educated. And that's true for everything in medicine.
You always say that. It's all about the data, and it's true.
Right. It's about the data. And you read a little bit about robotic surgery and
JAMA, the Journal of the American Medical Association.
And what do they say?
Well, so they summarize what robotic surgery is. It's a patient page that's in every issue, and basically a very recent one was for robotic surgery, and they explain exactly how it works and how the surgeon sits at a console and controls the robot's hands. And they talk about some of the risks and benefits, but for the most part, they reach the same conclusions you just told the listeners. Which is
so it's interesting.
There's no evidence.
You can read one thing, and yet people are being led down this path to get robotic surgery, even though it's not better, and it seems like it's worse, and there's high complication rates. And many people have relapse of their cancer. So anyway, I don't want to beat a dead horse, but I do want people to know that there is data out there. You can find the data. We'll show you the data. You can come in. You can call, and we will talk about all those things. I want to talk about a few cases this week before we get into more data. So an interesting man. He was diagnosed this year. He's a policeman in New York City. He's Irish origin, which means that he's got light skin and blue eyes in this case. And people with light skin have a higher rate of skin cancers.
Sure.
And so he was treated with melanoma to the brain. He had melanoma biopsy proven. And he just came back for a follow-up. He had 5 lesions in the brain. He chose to have radiosurgery only, to focus the beam just on the cancer.